Hello, Dr. Childress here. Welcome. In this video segment, I'm going to be talking to targeted parents about professional vitas. And one of the important things about hiring a mental health professional is to make sure they know what they're doing. If they don't know what they're doing, bad things are going to happen. So if you have an eating disorder and you go into a psychologist who has no idea about eating disorders, your eating disorder is not going to be receive the treatment that it warrants and that will produce a good outcome. If you have depression and you go into a mental health professional who doesn't understand how to assess, diagnose, or treat depression, then you're going to be in problems because your depression is not going to resolve itself because they don't know anything about how to treat depression. So that's true across the spectrum of pathology. So you want to go into a mental health, or you want to hire a mental health professional who knows the pathology that you're expressing. Now, I'm an expert in ADHD and attachment pathology. If I get a client from, let's say, a Iraq war veteran who has PTSD symptoms, maybe some family problems regarding PTSD and alcoholism, and so there's a PTSD kind of thing there. I know enough about psychology to go, oh, PTSD, that's what we're looking at. I also know that that's not what I do. I don't do PTSD in war vets. I know a lot about it. I could probably limp along to some degree. So if I'm working in rural Iowa and there's no other psychologist around, I can probably limp along and get some additional information to treat. But if I'm in LA and there's like the VAs here and there where people know how to treat PTSD, I'm referring over to them because this is beyond my boundaries of competence. Eating disorder, same thing. I've run across eating disorder kids because I work family problems. And when I run across it, I don't try to treat the eating disorder, the bulimia or whatever. I refer to an eating disorder specialist because that's beyond them. Now, I'm really good at attachment. I'm really good at ADHD, opposition. But that doesn't make me good at eating disorders. Okay, so one of the things as a parent that you want to do is to make sure that the mental health person that's treating your beloved children and your valuable family knows what they're doing. Okay. So how do we do that? How do we know that they know what they're doing? I wish, honest to God, this is how it should work. I wish the mental health professional should know their own competence and limitations, and when you come in with something that's beyond their competence, they need to refer you. So I need to refer on PTSD, not because the parent is vetting me on PTSD, but because that's my personal moral responsibility as a psychologist to say PTSD is being. And so that would be my hope. That's what's supposed to happen. It's not happening. It's not happening at all. These people, there's a predatory mental health professional in this forensic psychology domain that it's dangerous. There's a predatory energy to these mental health people that are preying on the vulnerable parents, and it has to do with money, and they're making money off of it, and it also has to do with their own psychology. They're coming out of their own family traumas, and it's kind of distasteful as I run into it, what's out there. So we're going to have to clear that out of the system. And we're doing that. We got a petition to the APA up, and I'm holding people to standards, which means I have to blow Gardner out because Gardner allows them to be incompetent. So we have to get back to standards that we can hold them accountable to. So we are working on that, getting rid of this predatory ignorance and incompetence in psychology that's preying on vulnerable families. So we're working on that. But in the meantime, parents are going to have to be informed consumers and take a little bit more responsibility for the treatment that's occurring with your families. If you just go in there and trust that the mental health professional knows what they're doing, in this particular type of pathology, in this domain, at this particular time, you're going to be in a lot of trouble because there's a lot of ignorance, there's a lot of incompetence, there's a lot of violations of ethical standards rampant within forensic psychology and court-involved practice. So you're going to have to buyer beware a little bit. So what I'll be doing in this set of videos is helping targeted parents know how to interview for your mental health professional. First thing to understand, that psychologist or that therapist works for you. Okay, actually they work for your kid. That's who they work for. But you are like the executive secretary of their boss. So you are the one, you're the parent. And so you're the one who decides on things. So they're working for you, as you're the decision maker as to who treats your child. Same thing as a dentist or a physician. If you don't like the physician that your kid's getting, you change physicians. Okay? If you don't like, if a physician tells you your child has a certain type of disease or a certain type of thing, and it's not making sense to you, or you don't trust that they got this nailed, go get a second opinion. Go to another doctor and see what that doctor says. Okay? That's like common sense responsibilities as a parent. Okay? If it's for you to understand the medical treatment of your child, for you to agree to the medical treatment of the child. If you don't agree with it, or if there are questions, to ask and get them explained to you, or to get a second opinion, all of that's totally normal. And it's normal in professional psychology. So, start stepping up as a parent. You got kids, start interviewing the mental health professionals. First thing, they work for you. You are the boss. They are your employee. Now, I know that's not what the mental health people think. You know why they don't think that way? Because right now in this field, you're being brutalized by a lot of incompetent and ignorant mental health people. They shouldn't be doing that. They should have the attitude, they work for you, you're the boss on this. Now, they actually work for the child, so they're not going to do anything that is against the child's interests, but they work for, you're the child's executive secretary. You're the one making decisions for the child. So they work for you in the child's best interest. So that's the linkage for the mental health person. And that should be just standard of practice. That's standard of practice in ADHD, that's standard of practice in autism, that's standard of practice across all of psychology except this little domain. In this little domain, it's attracted narcissistic psychologists. Why? Why has this attracted narcissistic psychologists? Because narcissism is produced by childhood trauma. So you have a lot of people going into mental health because of their own trauma kinds of stuff. You go back and look at my Vitae. That's how I got involved in my family trauma produced a psychologist. That's what happens. That's why we go into psychology and not into information technology. That's why we're not computer geeks. We're psychologists, because we're coming out of some sort of family issue or some sort of personal issue we're trying to work through. Now, if you go through my Vitaes series, you'll see I worked through that in therapy in my 20s and 30s and humanistic stuff. And so I worked through that. You got a lot of mental health people that haven't worked through that. They've come into psychology because of their own childhood trauma. And the way they're working it through is they're going into child custody evaluations or reunification therapy. They're working with high conflict divorce. Why are they doing that? I didn't want to work with high conflict divorce. Again, look at my Vitae. I stayed away from it. I don't want to do high conflict divorce. It's too dangerous professionally, and it's unfixable. High conflict divorce. God, no. I want to go a different direction. I want to go with something that's fixable, like ADHD. It's not fixable, but a whole lot more fixable than that stuff is. And so, no healthy psychologist goes into high conflict divorce. So who goes into high conflict divorce? The ones who are drawn to that personally, psychologically. And those are the ones with childhood trauma. Childhood trauma produces that narcissistic personality. That's where it comes from, is childhood trauma. So we see a lot of psychologists, I see a lot of psychologists working in this field who are arrogant and haughty and grandiose and absence of empathy. That is so striking to me about these mental health professionals, is the absence of empathy. And so that's one of the key things you can always look for. Does this therapist have empathy? Do they understand what I'm saying? Do they get it? If they don't get it, go hire a different employee who gets it. They work for you. You're the boss. If you don't like them, go hire somebody else. So that absent, but all of that narcissistic stuff, and what they're doing, these ignorant people, is they are working through their own childhood trauma by being able to judge parents and which is a bad parent, and try to get the parent to meet the child's needs, and so apologize to the child, and we're trying to appease the child. I mean, that's their own stuff from their own childhood. They're trying to get mommy and daddy to love them and to apologize for being a bad mom and their own child. It's their own stuff. Their own stuff that they're imposing on you. Yeah, that's a problem. That's a nightmare problem, actually. And it's rampant. It's all over through this. The field of forensic psychology is a mess. It's just a mess. And so we're going to have to clean it up. And so understanding how to interview for your employee, the interview for your mental health professional, is an important skill set that you're going to have to learn, because you can't trust us. You can't trust mental health at this time. At this point in time, the ethical standards of professional psychology and forensic psychology are non-existent. There is no ethical standards in forensic psychology that are applicable to you. Now, we're trying to get those. We got the petition to the APA. We're looking for them to step up and enforce their own ethics code. They're not doing it. They are not enforcing their ethics code regarding competence. And as long as they don't do that, it's open game. There is no ethical standards in forensic psychology because the APA refuses to enforce them. So that's the nature of the situation right now. Follow me over and we'll start to talk about how to look at Vitaes.